Hello, everybody. Good morning, good afternoon, good evening, depending on where you are. We'll just wait a few more minutes for a few more attendees, and then we'll start. Right, I think it's 2:31 Geneva time. Let's begin. Good morning, everyone. Good afternoon and good evening, wherever you are. And a very happy new year to you, since this is our first science communication webinar in 2022. It's great to have you all join us. I'm Supriya Bezbarwa. I'm the team lead for science and knowledge translation at WHO headquarters. And it's really a pleasure for me to moderate this session. With me is my colleague, Judith Van Holten, who has been the backbone of this webinar, this EPI-WIN Science Communication webinar series. So thank you all for joining. As you know, this whole series is started because with COVID-19, we realized the importance of people making evidence-informed, scientifically informed decisions at the individual and community level, and of people of various communities, including the medical community and the medical student community, getting the right information at the right time, having access to it and being able to absorb and understand it and make a difference. And as part of this series, what we've been trying to do is highlight some innovative ways in which we can get the science out there. So today, it's my pleasure to share with you two different experiences from two continents. The first is from the UK with Imperial College. And there you will hear about how medical students at Imperial College have been working collaboratively with local schools and communities as part of their undergraduate curriculum to address health priorities and challenges during the COVID-19 pandemic. And this while helping them, it's also helped, while helping the communities, also helped them as doctors, as future doctors. It shaped their own learning. And that is key, because it's always a two-way process or a multi-way process. Then you'll have a group of young medical students from Harvard. In the early 2020s, in March 2020, in fact, at the beginning of the pandemic, students from Harvard Medical School were pulled out of the hospital as the pandemic came to light. And they were very frustrated because there was not enough resources at that time on COVID-19, especially those geared towards their level of training. There was maybe, information for the general public, which was quite simplified, but for their level of training with a few years of clinical training, there wasn't enough. So they set out to design a medical student COVID-19 curriculum. This curriculum has now been accessed by over 200,000 times in more than 132 countries. So it's really had an impact, and it served as an effective tool for medical students throughout the world to learn about the pandemic and feel empowered when they go back to the clinical space. So two different experiences, all powered by youth, by young medical students. I should not be speaking any longer. I'll hand it over to them. We have, to start with, I'd like to invite the Imperial College. But before I do that, some housekeeping rules. So we'll have 2 sessions, one by Imperial College, the other by Harvard, 20 minutes each. And then we'll have Q&As. So if you have any questions, please put it down in the Q&A box and it will be answered at the end of the 2 sessions there. So without further ado, let me introduce from Imperial College, Dr. Aarti Maini, who's the Deputy Director for Undergraduate Primary Care Education and Coaching Lead for the Medical Education Innovation and Research Center at Imperial College London. With her are 4 medical students, Shamir Mohammed, Lauren Wheeler, Eileen Anto, and Arunima Basu. After their presentation, we will move on to Harvard, where we have Abigail Schiff, Karen Scheffer, and Derek Solet, all medical students, present their work. Their colleague, Kendall Carpenter, who is also one of the key people in this project, has not been able to join, unfortunately. But let's hope if she can, that will be great. Over to you, Aarti.
Okay, thank you very much, Supriya. I'm just going to share my screen, if that's okay. Okay, I hope you can all see this. So hello everybody. It's lovely to be here today. My name is Aarti Maini and I'm from Imperial College London. Thank you very much to the WHO team for inviting us to speak today. And in this webinar, we'll be speaking about our work of our medical students in addressing some of the challenges of the COVID-19 pandemic through science communication and how we've embedded this within the undergraduate curriculum at Imperial. And so our approach, firstly, to undergraduate primary care education involves providing opportunities for our students to learn in the heart of communities through meaningful partnerships that build on communities' strengths and resources to sustainably address health inequalities. And from year 1 through to the final year, our medical students take part in socially accountable service learning projects where they learn about social accountability, inclusivity, collaborative working and person-centered coaching skills. And this is all as part of their medical curriculum. And the idea is that they learn their curriculum through working directly with patients and communities to help to address community priorities, including through projects that involve science communication. And throughout this process, the students are motivated with an increased sense of responsibility through being involved in real-world projects that can really make a difference. And today we're going to be talking about 2 of these initiatives. So firstly, our medical students, Shamir Mohammed and Lauren Wheeler, will be speaking about their work for the I Explore module called Social Accountability in Action. And this is a module for year 2 medical and biomedical students. And then Eileen Anto and Arunima Basu will be telling us about their year 3 community action project. And so firstly, the year 2 I Explore module. So here we run a module for a group of year 2 medical and biomedical students where they learn about health inequity, social accountability, inclusive science communication skills and partnership working, all in the context of COVID-19. And they then work in small groups and with local school teachers to develop and deliver inclusive after-school STEM-based sessions about COVID-19 to local school children in secondary schools. And these so far have taken place online due to the pandemic. And our students also create educational resources for teachers to use on a longer-term basis with children to continue to spark those discussions around COVID-19. And this work really involves harnessing the power of science communication to excite students and school children about the science, and also to encourage them to act as positive influences with their family and with their friends in spreading accurate information about COVID-19 and also promoting vaccine uptake. And we hope that the sessions will help to raise the children's own aspirations also about entering higher education. And so I'm going to hand over now to Shamir Mohammed, one of our medical students, to tell us about his experience of the module. Thank you, Shamir.
Thank you, Dr. Maini. Hello, everyone. My name is Shamir Mohammed, and I'll be sharing with you the work I was involved with through the Year 2 Social Accountability in Action module. My group developed and facilitated an online after-school session for local secondary school pupils on COVID-19 vaccine distribution and associated barriers. Next slide, please. So one of the greatest aspects of this course was the fact that we were given a lot of freedom and open space to decide what we wanted to do during our session and be as creative as possible in how we planned it. As a starting point, it was really important for us to really get to know the pupils, find out as much as possible about their background, their life experiences, and really try to get a clear picture of their needs and priorities. We were helped in this by the secondary school teachers who knew the pupils really well and were able to guide us through what would be important to the pupils when it came to talking about the COVID-19 vaccine. We also wanted to make sure that our key messages from the lesson plan were clear and evident throughout the lesson, and we chose a problem-based learning method for our session as it allowed us to interact much more with the pupils. And we made sure everything followed a logical order that was easy for the pupils to follow. Next slide, please. So when running the session, we made sure that our lesson was as interactive as possible through the use of engaging presentation tools and plenty of online activities and quizzes for the pupils to complete. COVID-19 vaccine has also been a very complex topic, especially in the media. So we wanted to make sure that we had enough built-in time in the session to address pupils' reflections and thoughts. We found that online learning can be quite challenging with unexpected things happening all the time. For example, the pupils could not use the microphone or camera function during our session. So we had to adapt quite quickly to changing circumstances. And for example, use the chat function and using a lot of question prompts to keep the students engaged as much as possible. Next slide, please. So this course was definitely a very formative experience for me, with so many takeaways and learning points. From a science communication perspective, I realized the importance of knowing your audience in depth right from the beginning. Science communication and this whole course really was very much an exercise in empathy. I learned that in order to be able to communicate and discuss new and complex concepts with someone, it is vital to first have a really good understanding of how the person you're speaking to sees and perceives the world around them. I found that using a problem-based learning method was very effective in building on founding principles, especially starting with what the pupils already knew, really allowed them to then build confidence in their knowledge and critical skills. From a social accountability point of view, this course really highlighted to me how much science communication relies on trust between the two parties for effective communication. Where active listening plays a big role in developing this trust and allowing us to have open and honest dialogues and exchange different ideas and perspectives. Finally, I left the course with greater awareness of the societal barriers that certain groups in the community face, but also a newfound appreciation of the insights that younger generations can bring to the table and the power that they have to create change. And really my one hope throughout this course was that we were really able to empower pupils to be good role models in their own communities and drive positive change to their surroundings. I'll now hand over to Lauren Wheeler, who will share her experience of the course. Thank you.
Thanks, Shamir. Sorry, I'm having some connection issues, so I'm going to have to leave my camera off. But much like Shamir's group, our team's workshop centered around the COVID-19 vaccines. However, we chose to focus on dispelling the myths surrounding the vaccines, encouraging people to be more discerning about the information that they encounter online. Next slide, please. Our workshop was delivered using the virtual collaboration tool Miro, an interactive digital whiteboard, which allowed us to present the session in a fun and engaging format, providing the students with all the required learning materials, while simultaneously enabling them to communicate with us in real time in an accessible and anonymous way. Next slide, please. Although the use of a virtual collaboration platform was one of the main ways in which we tailored the format to student-specific needs, we took additional steps to maximize the impact of our session. For example, learning from prior discussions with the students' teachers, they may be reluctant to turn their cameras and microphones on or to volunteer individual contributions during the session, led to us asking the students to write their ideas on virtual post-it notes instead and add them to a group board. This was intended as a less intimidating way for the pupils to express their opinions and seemed to encourage participation even from the quietest members of the group. We also used our discussions with teachers to gain a greater understanding of people's knowledge and abilities, any unique requirements they had, and their expectations for the session. We further tried to help manage the students' expectations by providing a clear structure for the session on the platform, setting out approximate timings for the activities to allow for teleo anticipation, which we learned was the pacing of the students' attention throughout the workshop. Next slide, please. Using the online platform to run the session also provided us with a record of the students' contributions and allowed us to reflect on the workshop's success whilst identifying where it could have been improved. On screen, you can see some of the points we identified as strengths of our project, such as communicating clearly through the session design and delivery, and giving the pupils space to contribute anonymously and while still engaging interactively. However, there was also some challenges we encountered, and these included clarifying our own and the pupils' expectations for the session, as we found that these differed in the beginning. And also, there were still some challenges in getting the pupils to engage, and we did find that none of them did turn their cameras or microphones on. Next slide, please. In addition to the workshop, we designed an asynchronous activity which could be completed by the students with their teachers at any point, ideally as a follow-up to the session. Again, we incorporated a digital aspect into this, creating a briefing video on the storytelling platform Power2, which positioned the students as secret agents and encouraged them to hunt out myths online about the COVID-19 vaccines. Through this, we hope to foster a problem-solving mindset amongst the group and empower them with the critical thinking skills to address misinformation in the future. Our video instructed students to uncover the truth behind the rumours which they encountered on social media or in the news, and to report on their findings in a format of their choosing, whether that be roleplay, a poster, or traditional written response. We hope that this approach would help them to solidify their understanding through reflection, whilst catering to a range of learning styles and preferences. Next slide, please. Ultimately, our top 3 takeaways from the session were the importance of clarifying your purpose and seeking to understand the needs of the individuals or groups you're trying to serve. The need for a backup plan in case things go wrong or the technology fails. Given that our workshop was solely run through an online format, we were aware that any technology-related issues could significantly affect the delivery. We therefore had backup resources prepared to allow us to deliver the session via a worksheet should the platform crash or internet fail in another way. And finally, the critical need to communicate clearly, both as a team in order to design an effective, coherent workshop plan, and with our target audience to maximise the impact of our session. I'll now hand back over to Artie.
Thank you, Lauren. So our third-year medical students undertake an 8-week placement within primary care. And during this time, they complete a community action project. And this project involves working with their GP practice and with diverse patients, community groups and voluntary sector organisations to develop healthcare communications for local communities that take into account community priorities and perspectives. And I'll now hand over to Eileen Anto and Arunima Basu to tell us about their community action project.
Thank you, Dr. Maney. Good afternoon, everyone. My name is Eileen.
And I'm Arunima. So we carried out our community action project during our GP placement in the London Borough of Harrow. So this involved having to analyse the needs of the local community, create a sustainable intervention, and then analyse and evaluate the effectiveness of this intervention.
So after speaking to the GP staff, we realised that vaccination hesitancy was a significant issue in the local area. We found that only 5 out of 21 staff members at the local care home had been vaccinated. And our GP had previously delivered resources, but the uptake was still really low. Next slide, please. So our aims were to find out what the individual and community level concerns were leading to vaccination hesitancy, and then to produce targeted resources to address these concerns. And we really wanted to get the local community involved, as we believe that co-production would result in better engagement.
So now we're going to be talking a little bit about how we collected the data. So semi-structured interviews were conducted with 15 care home staff, and we explored reasons for vaccine hesitancy, perspectives on resources currently available, and preferred methods of receiving vaccination information. Additional data on this was gathered using an online survey, and we surveyed 55 care home staff from multiple care homes across Harrow. So transcripts from the semi-structured interviews and the survey data were then grouped together to identify emerging themes. Next slide, please.
And using the information that we gathered, 2 tailored video resources about the COVID vaccine were made. So the first video was an animated video, and the second video featured a compilation of videos of community leaders, representatives, and health and social care professionals across Harrow. And both the videos focused on addressing the main concerns that we previously identified through the semi-structured interviews and the survey. So now we're going to play a short clip from our animated video.
After the first dose, you will get good protection against the virus. And after having both the doses, you will get long-term antibody protection against COVID.
Thank you. Next slide, please.
After the first...
And now we'll play a short clip from the second video.
The experience of taking the vaccine were absolutely brilliant.
Really wonderful.
The operation was effective. It was like a celebration. Everyone was like smiling, happy.
When it was my chance and I got a chance to go and get it, I just dropped everything.
It's just like the last time I had my rubella injection, really. Sore arm, and that was it.
I had a heavy arm for about a couple of days. I took paracetamol for 2 days, and then, yes, that was fine.
I had absolutely no problems.
Next slide, please.
So from our initial survey and semi-structured interviews regarding reasons for vaccine hesitancy, we had a combined cohort of 70 care home staff. We identified 4 main themes of concerns: side effect, safety, need, and fertility. We found that there was a lot of information available about the vaccine, but it didn't answer their specific concerns. And in terms of how people wanted the information on the vaccine, video resources were really popular. Next slide, please.
So moving on to our conclusions, to get feedback for the videos were shown to staff at 2 different care homes, and focus groups were conducted with the staff to explore their reactions to these videos. Further feedback was also gathered through an online survey. So what worked? People really enjoyed the diversity of the videos, they thought it addressed their concerns, and they valued the direct messages from the participants. And in terms of improvements, people suggested that we add subtitles and improve the quality of the videos, as some participants were a little blurry.
We found that the Harrow care home staff had a wide range of concerns about the vaccine, and we found that our co-produced video resources were effective in addressing these concerns. So we recommend that to maximise effectiveness, video-based resources aimed at addressing community concerns are co-created with local community leaders and healthcare professionals. They are clear, accessible, and inclusive, reflective of the local community diversity, and they also incorporate direct messages from community leaders.
Thank you very much for listening to our presentation. We'll now hand back over to Dr. Maney.
Thank you, Eileen and Anto. So some final reflections on our experiences are that students can collaborate effectively with local communities to translate science and produce tailored, innovative, inclusive and accessible educational resources. And being involved in this work can help to shape students' professional identities and motivation, and also increase social accountability through community engaged service learning. We've also found that learning coaching approaches can help to build skills in inclusive collaborative conversations. And Imperial's recently launched 2 freely available MOOCs, or online courses, on coaching skills. So please do take a look if interested, and we've put the links and the QR codes here on this slide. Now, these projects wouldn't have been possible without the support of a wide range of people, from students to faculty to local schools, community organisations and other stakeholders, and I've listed some of these here. Thank you very much for your attention, and we would be happy to take any questions. Thank you.
Thank you very much, Dr. Maney and the entire team, Shamir, Lauren, Eileen and Arunima. what wonderful work, both with secondary school on different projects and working with communities through GPs and patients. And really looking at, what the key issues are and working with the communities, which I think is key, co-developing them based on the issues that affect them. I'd like to request all participants to put your Q&As in the Q&A box, so the questions in the Q&A box, sorry. And we'll go over now to the Harvard presentation, and then we'll have the questions and answers. So now we'd like to request the Harvard team to talk about how they've developed a curriculum of a different sort. Now, this is geared towards other medical students, what they did and the impact that had as well. Over to you, Catherine.
So I will get us started. Our group is composed of our leadership for the medical student COVID-19 curriculum. We will present on lessons from the development and maintenance of an online open access curriculum. So I'm presenting on behalf of Kendall Carpenter, myself, Katie Schaefer, and Derek Soled. So we all were medical students at Harvard Medical School, and we've been working with an amazing team of actually now up to 125 different, mainly medical students from Harvard Medical School to develop and maintain this curriculum. So today we will identify the role of medical students in developing curricula for their peers and innovative modes of scientific communication. We'll analyze the importance of open access curricula and their unique utility during the global pandemic, and discuss the challenges associated with curriculum development for a rapidly evolving subject matter, and describe strategies to sustain an accurate and updated curriculum. So in order to talk about this, we'll use the framing of a case. And our curriculum uses a few framing cases that go throughout, and so this is going to give you a taste of our curriculum. So we'll take the example of Lisa, who is a 26-year-old woman in her third year of medical school, who's interested in medical education and internal medicine. So thinking back to March 2020, she was pulled out of the hospital along with the rest of her classmates due to the COVID-19 pandemic. She felt helpless and she wanted to find a way to contribute to the fight against the virus. She also was worried about this loss of clinical time and wanted to ensure that she used the time productively. So she looked online to see if she could learn more about COVID-19 and didn't find many resources geared toward her level of training. At the time, there were many resources, or a few resources geared towards the public, but then also some geared toward medical professionals, especially infectious disease specialists. But really, there wasn't much available for the medical student level of training. In this case, Lisa wanted to know how she could contribute to the COVID-19 efforts, given her current limitations as a medical student, and how to progress her education and explore her interests during this indefinite time period. So focusing in on this, we can see that Lisa's interests in medical education and internal medicine are quite important. And then also that she wanted to contribute meaningfully, be productive, and then also contribute to the need of not having resources geared toward her level of training. So the problem at the time, so you can see here in March 2020, when we got started, there were not many peer-reviewed studies available. There were many preprints, but many of them were written at a different level. We identified a need, and then our goal, starting actually from the day after we learned that we were not able to go back onto the clinical wards, as I will detail, involved collating information about this new and rapidly changing virus at the medical student level. And in addition to that, we also wanted to incorporate many different perspectives about the virus, from things like the virology, immunology, to the impact on mental health, or communication goals, or trying to make sure that we understood policy perspectives. So we developed a curriculum, which started out as a 4-module curriculum. You can access it through this QR code here, and the URL is curriculum.covidstudentresponse.org. So you can see here at our landing page, there's 8 different modules, and an example of a module here with module 1 It describes the basic virology, host immune response, talking about clinical manifestations of COVID-19, treatment recommendations, and then understanding different therapeutics and vaccines. But then there's also many other topics which we've covered as well, and I encourage you to explore the website. So for example, here's some resources on COVID vaccines, but then we also have information about health disparities, mental health, communicating information, training for potential clinical roles, global innovation and collaboration, and medical ethics. So we started out as 15 third and fourth year Harvard medical students who wanted to contribute. The initial core started from a longitudinal medical education elective that runs throughout the year, but it expanded out from there. And we divided into teams based on our interests, including things like epidemiology, basic science. And we've really benefited in the US from having medical students who have a variety of backgrounds before they started medical school. So we were able to pull on these different expertise of our participants. And really, this was a student-led effort. We had some faculty advisors, but the leadership team, all of the content and the updating has all been led by medical students. We also incorporated medical education principles and pedagogical rigor, and we created a formal leadership structure to support updates. So we started on March 14th, and then within 1 week, so on March 20th, we put an 80-page curriculum with 4 modules online, which is free and hosted on Google Docs. During that time, we also made sure that we reviewed the content with medical student peers, and then also had Harvard faculty make sure that everything was accurate and up to date. And then within the next several months, we expanded to 8 modules, made sure that we hosted it on a globally accessible website because we had some users in countries where Google Docs was not possible to use. And even within the first few days after we posted it, the website crashed because we had so much interest. So we moved it to Gitbook. And then we created a formal leadership structure. And then currently we have 125 participants, and it's updated on an as needed basis. So I will turn it over.
Yeah, so thanks so much, Abby. Here you can see a lot of different features of the curriculum, one being the longitudinal cases that run throughout the curriculum. So we have 2 cases. This one is of an elderly woman at the beginning of the pandemic, Diane, and she has some uncertainty and fear that she's feeling. And so we follow her case throughout all 8 of the modules. To kind of tie them all together. In addition to summarized content drawn primarily from the primary literature, and always we have inline citations so that folks can click on the links as they go. The curriculum also contains thought questions to encourage students to think critically about the material they just read and how it can be applied to their clinical practice. So you can see those in the top right. And when practical tools are introduced, like this framework for empathetic responses on our communication module, students are challenged to apply these back to the cases that we've introduced at the beginning of the curriculum. And so I'll pass it over to Derek to take a little bit of a deeper dive into our module on ethics to show an excerpt from the curriculum and some thought questions as well.
Hi, everyone. Thank you, Katie. So here's a brief example from Module 8, Medical Ethics in relation to COVID-19. So the first section of the chapter dealt with principles of allocation. This is just the overview paragraph of that first section, and then it went into a lot more detail about different principles such as utilitarian models, egalitarian models, distributive justice models in which scarce resources could be distributed. Finally, there were a series of thought questions, some of which were included here, that push students to consider the numerous dimensions upon which physicians and policymakers may evaluate the sharing of scarce resources, both in their communities and their countries. Next slide.
Great. So to date, the curriculum website has had over 200,000 unique visitors from over 130 countries. It's being used for credit either in full or in part at over 30 US medical schools. At our own institution, students had the option to take a COVID elective in the spring of 2020, which included completing this curriculum along with assessment questions that we developed for the purpose of this elective, as well as some clinical or non-clinical service and reflective writing. The curriculum is available in 26 languages, all thanks to volunteer translators around the world. And those can be found in the kind of homepage sidebar of the website. We've expanded from 4 modules to 8 modules, as shown on the right side of this slide, to reflect the growing impact of COVID on different areas of medicine, public health, and global health. And I'll also highlight for this audience that our Module 7, Global Innovation and Collaboration, is a collaboration between Harvard medical students and medical students from countries outside of the US who are working together to develop that module. Our website also includes a link to a guest book where visitors can tell us how they're using the curriculum and give us any feedback. A thematic analysis of guest book entries earlier in 2021 showed that visitors were overwhelmingly grateful for high quality material that was open access and completely free. Guests also commented on the level appropriate to health profession students. Though we initially created the curriculum for medical students, we heard from nursing, physician assistant, social work, and other trainees about how they used our curriculum. As students prepared to return to clinical work following time away, there were increasing reports of using the curriculum to prepare, either required by schools or sought out by the students themselves. Next slide. And of course, there were a number of challenges in developing and maintaining a project this large that's also completely student run. Information about COVID was changing constantly at the start of pandemic as well as now. And we needed to balance staying up to date with staying high quality. So we decided initially on a system of weekly updates that could be faculty reviewed before we posted them online, with allowance for immediate changes if something posted was factually incorrect. As the pandemic progressed, the rate of updates slowed to an as-needed basis. We also adjusted our approach as more resources became available, especially educational ones targeted toward health profession students. We recognized that other sources would be best for up-to-the-minute data, such as a lot of the local dashboards that different localities were posting. But we continued to offer the strengths of covering major themes within the scaffolding of our additional curricular elements, like those thought questions and the longitudinal cases. At the request of faculty around the country and around the world, we've also explored creating cases for synchronous group-based learning. And finally, as students, we've had to overcome members of our team graduating, such as Abby, who is now an internal medicine resident, going through difficult clinical rotations, such as our colleague Kendall, who is in the pediatric ICU on a clinical rotation right now, and other shifting responsibilities as we move through our training. But having a core editor team has been essential to allow other members of the team to step up and step back as they needed.
So over the last few months, we've continued to maintain this curriculum in addition to a K-12 curriculum geared towards children and adolescents. However, as Katie previously said, we acknowledge that our updates have been smaller and less frequent, as there is no longer a need for content and information development compared to at the beginning of the pandemic. At some point this year, we intend to create a hard copy version of the curriculum to preserve for years to come, and perhaps as a guide for medical students during a future pandemic or crisis. Also, at the request of educators across the globe, we're also working on transitioning the material into a case-based format for in-classroom use. Next slide, please. So there were several takeaways from this project. First and foremost, medical students have a key role to play in science information dissemination and curricular development, as they are key stakeholders with the time and access to information needed to write a curriculum, and they have the ability to represent it at an appropriate level for health professionals. The model of student-led curricular development allows students to transform content interpretation into a tool for public use. During a time of crisis, students self-assembled in areas of their interest, which allowed participants to play to their strengths. Peer and faculty review ensured accuracy, and online guestbook feedback allowed for a self-correcting process. This curriculum has empowered medical and health professional students to transition from content consumers to generators, create a highly accessed open access, and up-to-date resource with global reach, and finally, to play a crucial role in teaching about COVID-19. Next slide, please. As US President Dwight Eisenhower once said, "Planning is everything, the plan is nothing." When you see enthusiasm, harness it. Even if you don't know the path, you should be planning from the beginning about how you intend to get your message out and why that message is important or not already present. Always have an end goal, even if the path there is uncertain. And finally, just to summarize in the next slide, as has already been stated, as of December 2021, the curriculum's home webpage has had over 200,000 visitors from over 132 countries. So many US medical schools, as well as medical schools around the globe, offer the curriculum or its components for credits, and many offer it as a supplemental resource. The curriculum has also been made available in over 26 different languages, and thousands of entries in the guest book highlight its global reach and utility. If nothing else can be gleaned from this presentation, it is this: medical students can and will continue to serve an integral part of science information dissemination. Thank you. We're happy to take any questions at this time.
Thank you so much. Congratulations to both teams. And absolutely, I mean, I think medical students, as your experience shows, play such a critical role in science education, and that makes such a difference. Two very different approaches, one as part of the curricula, working with communities, including secondary school students, GPs, patients, others. And then you have students working for students in their curriculum, both of them having great impact in their own way. We have a few questions on the chat here. Many of them have already been answered, but I think I will use my moderator's prerogative to throw the first question up to both groups, first to Imperial and then to Harvard. Having done what you've done, how did it change you? Did it change your insights in some way? Did it change the way you think about life, about your profession? How did the experience change you? Maybe first to the Imperial group and then to the Harvard group?
I think this is probably best answered by our medical students. Shamir, Lauren, Eileen, Arunima, I don't know if you have your perspectives on this really interesting question.
Yes, thank you for the question. So one thing that was really highlighted to us during this whole process was the importance of involving the local community. There were a lot of concerns about the vaccine that we just didn't know about at the practice, but after speaking to all these individuals, we were really able to see where these kind of beliefs came from and why they felt the way that they did. So that was really useful.
Great. And would you like to say anything?
So I think, like I said in my presentation, this course was very much an exercise in empathy for us. And because it was a longitudinal course, it ran throughout half a year. The change happened so subtly that by the end, we turned around and we looked at where we started and where we ended, and we were completely different people. And in how we thought about talking to people about our job or what we're passionate about. So I think that was the biggest difference for me, at least.
For me, I think it was, For me, I think it was probably the importance of not thinking you know all the answers, not just parachuting in and going like, we know what's right for this community. It's about talking to them, developing, like everybody's sort of been saying, co-developing the solutions and really trying to empathize and get the most effective solution for all. Yeah.
And just to add to that, certainly we've been on a learning curve as faculty as well. And many of us in terms of the medical faculty, we've been brought up in a way where it can be very doctor-centered. We go and we do things to the community. That's how we were brought up as medical students, and many of us have preserved that outlook. And so this is quite a different way of looking at things, very much sort of rebalancing that power dynamic and really recognizing the value and the assets that our community resources bring, and being able to learn for ourselves as faculty and to work in a very much more balanced way, in a much more equal way with community, has been invaluable for us, really helpful. And for us to be able to then model that through incorporating initiatives within the curriculum, really explicitly training students in these skills and in a mindset. It's a mindset really that that communities are really valuable, their perspectives are important, and we can't just carry on with this notion of thinking we can just do good by going into a community and just implementing something onto them. It shouldn't be about doing something to a community, but rather working very collaboratively with them to jointly explore what the needs and priorities are and how we can jointly address those. So that's very much I hope what our students are getting out of it, and all indications are that is something that has been valuable, but also for us as faculty.
Fantastic. So it's not just the community learning about it, but it's a two-way process, and this learning goes both ways, and probably with an impact throughout your lives. Over to now the Catherine and colleagues out there. If you have anything you'd like to share about how this changed you or what difference it made to you.
I'm happy to start. I think for me, this was really kind of the launching board for my interest in medical education. Now, as I'm preparing to graduate from medical school and thinking about what I want my career to look like, I definitely want medical education and continuing to not just educate medical students and medical residents, but involve them in creating their own educational experiences is definitely something that I want to kind of carry forward with me in my career. I also think I served, in addition to being on the leadership board, I served as the editor for the health disparities module. And it was a really nice way for me to tie in interests that I had kind of thought as two different things, medical education and health equity, to kind of realize that I can do both of these things together and they can become really powerful if I can kind of join these interests together. So I'll pass it off to my colleagues.
Lovely. Abigail and Derek?
Yeah, so I echo everything that Katie said. I do feel like this was a really amazing way to contribute. And it also helped us turn from content consumers to content sharers, content producers. So personally, I also have a background in immunology and virology. So I had worked on HIV in the lab. And so it was exciting to be able to use the skills that I had in terms of consuming scientific literature, analyzing it, and also producing it, but then bringing that to a science communication perspective. And I think both on the medical side and the scientific side, there's a growing interest in having people who are trained in these areas also share it with other peers or other people in the field. And I think science communication is a really important skill that should continue to be incorporated for students at all levels, because it helps not just with understanding, but also with the development of new questions and the development of new approaches to pressing problems like the COVID-19 pandemic. So it's really been a wonderful experience to be involved in this, and also has created a great community around science communication at Harvard Medical School.
Great. That sense of community is coming through very strongly, Derek.
And last but not least, just to echo everything else that others have said, it was a really good learning exercise in terms of leadership and management. So we were at a point where there were really tens and then hundreds of students who were really passionate about this and wanted to contribute. And it was a little bit chaotic, to say the least, just so much enthusiasm and figuring out the logistics channels so that people can channel that enthusiasm into creating a coherent product, that was neat, organized, and, had an avenue really and reach. So I would say this Was a lot of learning on the job, but was really a good exercise in figuring out what makes for successful leadership and managing priorities.
That's amazing. You have not only the community spirit coming up, but also lots of leadership qualities and skills that you've learned. So it's obviously, doing this has multiple two-way learning and developing as well. We're getting lots of interesting comments on the chat box of many people inspired by what you've done, but many people also talking about what they've done. So please keep that coming. We'd love to hear about what you've done. I think there was a hand up as well, Jagannath. Right, I'm just going to, you can ask, if you had a question, please go ahead.
Okay, am I audible?
Yes, you're audible.
Okay, I'll take 30 seconds. Complementary response I wanted to say. Professional students from the medical background doing is really a human service. So that is point number one. Point number two, I think we have to keep an eye on the UNESCO International Environmental Education Program of 1977, which made education mandatory guidelines. The second one being the UNESCO in 1989 confirmed that science leads with culture. So what we have done in our experience of lockdown is to get into the cultural signature of the 5th to 9th standard students. So 1 hour a week it was the assignment. I will share the our results. To end, I would like to tell you what we get into the local dialectics. That can enrich the.
You're not terribly audible. Maybe you can come closer to the mic or something.
Yeah, actually, I'll try to put it this way. Is it okay now?
It's better. Yes.
Is it okay?
Yes, better.
I think I'm sorry I had kept the headphone in the wrong position. I want to just conclude by saying that taking these models into local dialectic, it will make a whale of a difference. Because at a top level, Imperial and Harvard, they are on the top of the world. Being an alumni and mentor of International Space University, still I feel science communication and the local dialectic is the best way, especially in the infodemic management. I have become recently the infodemic manager in the 3rd WHO training. I think the local dialectic is the key. If that can be taken, it will be geometrical impact, reaching hundreds of countries is not adequate. You have to get into the local dialectic and ask the artists, writers and poets to respond to this, as happened in our, COVID time, a simple comic, You Are My Hero. See, it made such a big impact all over the world. And it came in the local languages, local dialectic. I think it's the time that we get into that sort of a, science communication. It will be great contribution. Thank you very much, all of you.
Thank you very much. Very valid point about taking local realities into consideration and having doing science through art essentially as well to reach them. And I think there were some questions there also. I think they were from you on the chat, to which Dr. Mani has also responded on the cultural aspects of it and how that can be used. There were some questions in the chat about the recording of the webinar. We will share the recording with the slide sets with everybody. We do that every time after the EPI-WIN Science Communication Conference. There was one question on how did you encourage the community to participate with you, which Dr. Mani has responded to on the chat. One on the survey question and results of the assessment, which also Dr. Mani has responded to on the chat. And final question from Elena Riza, will the online curriculum be available after the pandemic? This is for Harvard, when we resume teaching normalcy. Over to Harvard.
Yes, our plan is to keep the curriculum available online and open access. That's been our value from the start, is to keep this completely free and available to anyone who would like to access it. Our hope is that the pandemic will come to an end and we can keep it available after the pandemic. But at this point, we're committed to keeping it available through the pandemic.
Thank you. So Arti, would you like to also, share with everyone the answers to some of the questions, especially about how did you encourage the community to participate with you?
Yeah, sure. So just sort of following on from the previous really valid point about taking into account local dialects and the power of that is really important, and it really highlights the need. It's not just something that would be good to do, it's essential, I think, to have that community collaboration and community engagement, and not just engaging in what we want to do, but hearing and exploring the community's own ideas and strengths and assets, what's already there that we could draw on, what are their perspectives on this, and how do they think this could best be translated, what are the different mediums by which that could happen. And with that in mind, over the last couple of years, we've really been trying to strengthen considerably our links with our local communities. We're really lucky. We have very diverse local communities on our doorstep in London at Imperial. And we have a community collaboration lead whose role it is within our department to link with these communities and to build relationships. It's not enough to sort of drop an email, but to really kind of nurture and sustain those relationships and involve them where we can in our work, and get to know who they are and their work, and get to know them on that personal level. And then with that foundation, then start to involve them where it feels relevant for them as well, with their own goals and their own priorities, involve them in our curriculum work and get them hopefully working more closely with our students. But alongside that, really training up our students and ourselves as faculty in approaches to holding those conversations, and what we spoke about earlier, that mindset shift, sort of rebalancing it from we know best to actually, in this context, in many cases, community knows best. And it's about how we can work together to tap into those resources. And that involves a mindset and a way of thinking and a way of communicating. So we aim to train our students and our faculty as well in coaching skills for those collaborative conversations. So that's the way that we are approaching this at the moment.
Great, thank you very much. I'm just looking at all the questions now. And I can see also that we're getting more and more information on other initiatives, such as the GIANT program from the San Francisco Bay Area. So many people doing amazing work. Please do share with us how you've been working to reach out to science communities. And I hope these experiences that you've heard will also inspire student communities all over the world. Also, both presentations, both groups have shared the links to where you find all the material. So all of that can be used as well to further be adapted to local conditions and initiatives all over the world. So, the key point here from today's thing is collaboration, working together, and as Arti Maini said, Dr. Maini said, that it's a two-way. It's not about just us going and doing it. It's also learning from communities. So these are very important sort of ways of looking at perspectives that we need to think about in science communication as we move forward. So thank you very much. If there are no other questions, thank you very much, and congratulations to both teams. We're just coming up to 1 hour now, and congratulations also to both teams for actually keeping to time. I think it's very rare, but you've been both teams have been fantastic, given such succinct, clear presentations within the time allotted. So fantastic. And thank you once again. Any last words, Dr. Maini and Harvard team?
So I think from my perspective, I think the collaboration word is the key, and collaboration between faculty, communities and students as well. We found our students hugely valuable resource, and we're continuing to work with them. And the other key word is sort of keywords, I suppose, diverse and inclusivity as well. So doing this, so recognizing the diversity of our students and communities, and recognizing that we can really maximize that diversity through inclusive approaches, and then we get the best out of everybody and develop the best initiatives going forward that will really make a difference.
Thank you so much. Fantastic words: collaborative, inclusive, and others. Great take-home messages, actually. And then over to Catherine and Derek and Abigail. Any last words?
I think Dr. Maini put it perfectly. I would just echo Abby's words in the chat. Thank you so much for having us today, and thank you to the Imperial College team for your work and for the opportunity to hear about it. It's been really wonderful.
Thank you, and likewise, the Harvard team, your work has been hugely inspirational, and thank you, Supriya, and the WHO team for having us today.
So thank you very much, and thanks to everyone who participated, and thank you also to the participants who shared their experiences. It's wonderful to hear from those, and great to know. And we continue to be having such seminars monthly, and we continue to work together and learn from each other to move science communication for public health emergencies forward. Thank you very much once again, and see you soon. See you next month.